Ask unanimous consent that
Senate's
quorum
in a
call be
quorum call.
eviscerated.
Without objection.
Ask consent that the order for consideration of the child nomination be modified to occur on Tuesday, January the 31st.
Without objection.
Mr. President, in 2010, when I ran for Congress, all the questions circled around the Affordable Care Act. Every town hall meeting, every conversation, everyone that caught me in the grocery store, everywhere that I went, it was a conversation about the Affordable Care Act. What's going to happen? Where are things going to go? And a lot of concerns on it. The President promised at that time, if you like your insurance, your doctor, and your hospital, you would keep it. And it would just get better. Prices would go down, options for insurance would go up, there'd be marketplaces where more and more companies would rush in, and that would drive the prices down. Now, 7 years later, the greatest fears of a lot of the Oklahomans that I'm around all the time have come true. Here's the crisis in Oklahoma dealing with health care. We have the highest rate increase in the entire nation. Last year, our rates went up in Oklahoma 76%. Last year. The year before that, they went up 35%. That is a 111% rate increase in 2 years in my state. Over the course of the last 3 years, insurance companies have left my state. All 77 counties of Oklahoma now have one insurance carrier left. I met with that insurance carrier before. They're seriously looking at how they stay functional in Oklahoma in the days ahead, which is a concern to me that there's a possibility we may have zero on our marketplace in some counties and in some locations in Oklahoma. With a 76% increase, I've had some folks that have caught me and said, well, your state didn't expand Medicaid. That's the problem. If you had expanded Medicaid, then it wouldn't have been an issue. Well, I would tell you that it has now come back with a study from HHS that they have confirmed that that's true. If our state would have expanded Medicaid, it would have reduced our cost 7% total in the state. So that meant instead of having a 76% increase like we had, we would have only had a 69% increase of healthcare costs in our state. Zero competition, dramatically higher deductibles, dramatically higher premiums. Every hospital in my state, rural and urban, every hospital in my state has more charity care now and more bad debt now than what they had 7 years ago. Insure Oklahoma, a program that we had set up a decade ago to be able to take care of people that did not have access to insurance, continues to falter because my state is playing Mother May I with every year with the federal government on whether we can maintain a program that our state had and was growing. Small risk pools are not allowed. People still don't know the price of their health care. Electronic health records can't talk to each other still. There's still a rise in the cost of prescription drugs. We still have overlapping administrative costs on dual eligibles, Medicare and Medicaid, for senior adults. Compliance costs for our doctors, our clinics, and our hospitals have skyrocketed. Physician-owned hospitals, which we have quite a few in Oklahoma, have been cut off and limited since 2010 and are slowly struggling just to be able to stay afloat. And fewer doctors are taking Medicare and Medicaid patients. On the horizon, Mr. President, it gets even worse. Because most people don't realize the Affordable Care Act was backloaded, that the worst of it wouldn't be for several years out. Well, guess what? It's now several years out. Union households in my state are about to take a major hit with the Cadillac tax that's coming. Because union households in my state have their insurance is too good, and those individuals will face a tax increase. The insurance company tax is coming, which is a massive tax increase on insurance companies, which way they will pass directly down to consumers that cost, and so it will go up again. And we continue to fight off the Independent Payment Advisory Board, a board specifically set up to be able to cut options for patients if they cost too much. That's still out there on the horizon. Not to mention the tax penalties that go up even more next year. People ask me, why are you still focused on repealing Obamacare? Why is this such a big deal? It's because the people in my state are struggling under the negative effects of this, and it's got to be dealt with. Let me just give you a couple real-life stories. An Oklahoman from Altus, Oklahoma, in the southwest part of my state, wrote me, and he said, Senator Lankford, I came home tonight having finished the cotton harvest and looking forward to celebrating with my wife and my kids after harvest. I was greeted at the supper table with somber news about our health care premiums from my distraught wife. Our premium is going from $960 a month to $1,755 a month. That's with a deductible of $6,000. I can't even process and figure out how to handle this. I'm through. I'm done with any hope for any bright future for my family. An Oklahoman from Podo, Oklahoma, wrote me and said, my husband and I have had healthcare marketplace health insurance for the last 3 years. This is the first year my monthly premium was over $1,200. This year I will pay $1,923 monthly. I now get a letter from my health insurance carrier that my monthly premium will go up next year to $3,540 a month. That's an increase for our family of 84%. How is this possible? And how can anything be done about this? When individuals ask me about Obamacare and they say, you're just arguing about something because of disdain for the president. No, this is what we have disdain for. This is what people are frustrated about. People that work, people that pay for their health care insurance cannot pay their mortgage and their health insurance anymore because they're literally priced out of it. This is what Bill Clinton meant in October of last year when he made this statement. So you've got this crazy system where all of a sudden 25 million more people have health care, and then the people who are out there busting it, sometimes 60 hours a week, wind up with their premiums doubled and their coverage cut in half. It's the craziest thing in the world. I could not agree with Bill Clinton more on that, because that's exactly what's happening in Oklahoma. But now here's what's happening. Because for years, Americans and Oklahomans have said, we have got to do something to stop this. It's choking out my family. We are finally at a point we're going to do something about it. But I have colleagues that are now spreading the fear all over the country that suddenly everyone's going to be thrown off their insurance and we're going to have people living out on the streets without coverage. I've heard on the floor of this Senate, 30 million people could die if we repeal Obamacare. I've heard 20 million people will lose their insurance. I've heard there is no replacement plan. People will get sick because their coverage will be gone. Well, let me just go through a couple of those. Because there are people calling my office and writing me that are very concerned. They're cancer patients. They're diabetics. There are people with long-term blood diseases. There are people that are very difficult to be able to get insurance. And they're being told that all those mean Republicans up there don't like you and don't care about you, and they all want to just throw you out on the street. When the people that say that, no, it couldn't be further from the truth. It may make for good politics, but it's using people that are in a very vulnerable spot in a negative way. First, let me just get a couple facts straight. This 30 million number that's being thrown around, even the president doesn't agree with that. Even past President Obama doesn't agree with that. It's not 30 million. In fact, it's not even 20 million. It's 14 million people that have gained access to health care coverage. If you count the people that have actually gained coverage and paid for their premiums through the course of the year, or have been a part of the expansion of Medicaid. Of those 14 million people, 11.8 million gained additional coverage from Medicaid, not from the exchanges. And of that almost 12 million people that got expanded coverage from Medicaid, Jonathan Gruber, who's one of the architects of Obamacare, made the statement that from their own studies, the vast majority of those people that were added to Medicaid weren't added to Medicaid because of expanded coverage. They were added to Medicaid because of promotions that are out there in advertising. They were already eligible for Medicaid. So really, we're talking about 6 million people or so that have been added to it. Now, I'm not belittling those 6 million people. That's a lot of people. But it's not 20 million, and it's not 30 million. So now what? As people address this to me, they ask, what just happened on January 6th? When the Senate and then later when the House voted to start the legislative process to repeal Obamacare. What just happened? Well, we actually just started the process, is what happened. It wasn't a total repeal. No one's been thrown out. It starts a legislative process. And as we start that legislative process of what's called reconciliation, and as we work through that process, it's a very simple process. It starts the opening conversation to work through committees, to work through debate on the floor, so that in the days ahead, we will bring a full repeal of Obamacare and a replacement. But that replacement's not going to be a 2,700-page bill to replace the previous 2,700-page bill. It'll be a series of solutions. And it'll deal with things over a long-term basis. It's not a vote that suddenly ends people's health care in one day. This begins a transition point to make sure that we're watching out for those individuals, like those cancer patients, like those diabetics, like those individuals that are in very vulnerable situations, that over the next couple of years will be able to transition to other care. We are watching to make sure that this is not some sudden shift for those individuals. Understanding there are very vulnerable people that are in our healthcare options right now that need to make sure that they know there is still that safety net there for them. And that moving forward, we'll continue to be able to watch for them. We want to be able to move back a lot of those decisions back to the states. Quite frankly, that's where those decisions were before. And we want to be able to allow those individuals that are in very vulnerable situations to seek out the doctor they want, to get the options for the health care coverage that they want, and to have greater access to insurance, not less. Because the people in my state that have been added, that have received those subsidies, are grateful to be able to have health care. But those individuals that in my state that can now literally no longer afford to have health care because they've been priced out of the market are stuck. Obamacare moved the system from uninsured from one group of people to uninsured for another one. Let me give you just one statement. Coming from a person from Oklahoma, said, "My wife and I will be going without health insurance next year. I don't resent anyone who is not able to afford health care. I just resent a government system that causes us to be priced out of the reach for working people." Why is it we can argue about Obamacare and people can say those individuals got coverage and people are not paying attention to a whole new group of Americans that no longer have coverage because they've literally been priced out of the market? Why is it for the sake of 6 million people we've affected the cost of health care for millions and millions of other Americans? We can do this transition. We will do this transition. It will take a couple of years. It's not going to be rapid, and there'll be a large debate that'll happen nationally in the process. That's appropriate. But allow us to be able to walk through this process together. One quick illustration, Mr. President, then I'll be done. I have a friend of mine that she discovered last year she had mold in her house. Initially, there was some treatments that were done, but she'd been very sick for a while, didn't know why. They did some treatments to the house and such and thought that would settle it. It didn't. Eventually, she had to move out of her own home. Now they've had to actually strip the walls and take out all the sheetrock. They're literally replacing studs, replacing everything in the house, and it'll be a long-term issue to be able to get it all right. I tell you that simple story to be able to say, anyone who says that replacing healthcare is going to be some simple spray everything down and it's going to fix it doesn't understand the complexities and the difficulty of American healthcare system. This will be much like my friend who's having to do a pretty radical transition that's going to take a long time, but that will actually get her house whole and healthy again. If we want to have a healthy nation again, people that have access to healthcare, regardless of what class that you're in, it's going to take a while to make this transition, and it will be difficult in the process. But I can assure you, this Congress is watching out for all people, of all ethnicities, of all neighborhoods, of all diseases, to make sure that we are paying attention to this one simple thing. When Obamacare was put into place, it punished people. We should encourage people to be able to get health care and should be able to walk through with people in their most vulnerable moments and make sure they're able to have personal decisions, access to their own doctors, access to hospitals that can afford to stay afloat, and the ability for people to choose their own insurance. Why is that so radical? It used to not be. There are things that need to be fixed, but it begins with giving the power of the decision back to the patient and back to people where it needs to be. With that, Mr. President, I yield the floor.